Hey guys, Dr. AJ here. Neck pain's the worst. It can give you headaches, it gives you sharp pain when you turn your head. In some cases, it can become chronic and last for years. Adjusting or cracking your own neck can give some serious relief from neck pain and stiffness and helps maintain the mobility in your neck. I learned how to crack my neck when I was about 16 years old. Years later, I got my doctorate in physical therapy and advanced training to learn how to manipulate other people's necks, and now I'm going to show you how I do it. I actually used to have neck, back, and knuckle cracking competitions when I was in training to be a missionary. We would all be reading quietly in class when suddenly the room would explode with the sound of joints cracking. It was like a duel. Sometimes I would start, sometimes the other missionary would start, but I'm pretty sure I always won. Before I show you how to get some extremely satisfying and pain-relieving cracks, let me tell you when not to do this. Don't crack your own neck if you have had a recent injury to the neck or if you have severe neck pain. It's best to get it checked out by a qualified healthcare practitioner in those cases. I also wouldn't recommend cracking your neck if you have had a cervical spine surgery, so like a neck spinal fusion or other similar surgery. If you have numbness, tingling, or shooting pain down either arm, this is something you should also get checked out for. Go see a physical therapist. Cracking your neck usually doesn't help that. It can actually make it worse. If you have unexplained dizziness, blurred vision, numbness in the face, especially when turning your head, don't crack your neck and definitely go see a doctor. You should know there is a risk when cracking your neck. One risk is that you cause injury to your neck that will be annoying and take longer to get better. The other risk is more serious. There's a very small chance that you can cause injury to an artery in your neck, which can lead to a stroke. To put it into perspective though, you're much more likely to get hurt in a car accident, become hospitalized, or die from taking anti-inflammatories like ibuprofen, which causes 107,000 hospitalizations and over 15,000 deaths each year in the United States. Many people are probably going to crack their neck anyway, but if you follow the guidelines I'm going to give you, the risk is even smaller. So we're going to avoid a big rotation kind of movement of the head and neck. That's what causes the highest risk, but if you're not comfortable with the risk, then don't do it. Remember, this video is for informational purposes only, and as always, if you try this at home, you do it at your own risk, and definitely don't try to adjust anyone else's neck for them. So now to do this, we're going to move the head slightly back and to the side. So if you move your head back and to the left, you'll feel some tension start to build in the right side of your neck, especially as you slowly rotate your head to the right. Then with your hand on your jaw, or sometimes I'll put my hand on the cheek a little, you'll want to apply a little pressure upwards towards the eye, just a small movement, and you should get one or multiple cracks. So sometimes I'll side bend my head a little bit more to help build up more tension to get more cracks. You should only be applying a gentle pressure and don't push through the pain if it's hurting. So afterwards, you'll usually feel an instant release of tension in the neck. If you feel like you need to crack your neck all the time, then you should probably do some strengthening of the neck muscles or see a physical therapist for some specific recommendations and treatment, such as a combination of spinal manipulation, dry needling, and exercise. I find that works really well. So if this has been helpful, make sure to give that video a thumbs up and leave your comments below. Thanks for watching. Have a great day and stay strong.